we continue covering the digestive system. So this is video 2 that covers digestive system, and I will leave the link to the first part in the description section. So we already covered most of the, we actually covered all GI tract, starting with oral cavity, continue with pharynx, esophagus, stomach, small and large intestine. We also covered some of the accessory organs. We covered salivary glands, teeth, and we're gonna start with over here with the largest gland in your body, that is liver. So it's the largest gland in the body. It has 4 lobes. On the anterior surface, you will find right lobe, that is the biggest one. So here's the right lobe. And the left lobe. There is a separation between them. The separation is called falciform ligament. Now, if you look at the visceral part or posterior part of the liver, you will find 2 more lobes. It's a caudate, and caudate means tail, so it does look like a tail, and quadrate, and quadrate means square, so that lobe look like square structure. Next to the quadrate lobe, you will find gallbladder. Now, also, if you see this falciform ligament, that the most inferior part of the ligament called round ligament or ligamentum teres. So falciform ligament separates the larger right and smaller left lobes, suspends liver from the diaphragm and anterior abdominal wall. And round ligament or ligamentum teres, it's a remnant of fetal umbilical vein along free edge of falciform ligament. So you can see liver over here and some associated structures such as gallbladder, different ducts that we will discuss in a minute that carry bile to the small intestine. Inferior to the liver, you would find duodenum, that is the first part of the small intestine, and pancreas. That is another accessory organ of the digestive system. So liver-associated structure. Lesser amentum anchors liver to stomach. So I want to remind you that lesser amentum is attached to a lesser curvature of the stomach, and it's attached to a liver. We have hepatic artery and hepatic vein that enters liver at the area that is called porta hepatis, and ducts. So a liver has many functions in your body. It synthesizes most of the proteins of your blood. It stores glycogen. But the function of liver that is related to the digestive system is production of bile. And you need bile to assist in digestion of fats. So if liver makes bile, this bile enters into 2 ducts over here. We call right and left hepatic duct. So here's the right hepatic duct and left hepatic duct. Then they join together, forming common hepatic duct. And common hepatic joins with a cystic duct, that is a duct of gallbladder, forming common bile duct. Common bile duct deliver bile to the small intestine. So common hepatic ducts leaves the liver, right? So that's common hepatic duct right there. Cystic duct connects to gallbladder, and bile duct formed by union of above 2 ducts, cystic and common hepatic, that gives us common bile duct. Now, liver will make bile, and you store excess amount of bile in the gallbladder. Microscopic anatomy of the liver. Now, we just described 4 lobes of the liver: right lobe, left lobe, caudate, quadrate. Those are large macroscopic structure. But on a microscopic level, liver is divided into liver lobules. They are hexagonal structural and functional units. So here you see 1, 2, 3, 4, 5, 6 sides. So it's hexagon. And they filter and process nutrient-rich blood. So blood from your GI tract, when it's when it picks up nutrients, flow to a liver first for processing. Now, lobules are made of plates of hepatocytes. Hepatocytes is the name of liver cells. And it has longitudinal central vein. So right in the middle, we have central vein. So let's look at the structure of lobules in more detail. So here's we see one liver lobule and made of cells. So all the cells are hepatocytes. Now on each corner of this structure of this lobule, you will have what is called portal triad that is made of portal venule, portal arteriole, and a bile duct. So on each corners, and we have 6 of them, we have a venule, arteriole, and bile duct. Right. Now you deliver blood through the venule. Now through the venule, you have blood coming from GI tract, and you have blood coming through arteriole, that's branches from aorta, so it's oxygen-rich blood. And then the blood really flows through this structure called sinusoids, right? So we have those sinusoids. And when blood flows through the sinusoids towards the central vein, those hepatocytes take care of that blood. So what exactly they do? So here we have hepatocytes functions. They process blood-borne nutrients, store fat-soluble vitamins, perform detoxification, and produce about 900 milliliters bile per day. So when blood flows through the sinusoids, we clean it, we process nutrients, we store vitamin, we detoxify the blood, and then blood from the central vein then flow to the hepatic vein and inferior vena cava, right? Well, finally, in inferior vena cava. Another accessory organ of the digestive system is pancreas. Pancreas has both functions, or it functions as exocrine and endocrine gland. Now we interested in exocrine portion of the pancreas because that portion is relative to the digestive system. Now, if you look at the pancreas, you will see this round structure called acini. So here one acinus, here's another acinus. And those acinar cells, they secrete digestive enzyme. And they deliver those enzymes through the duct to the pancreatic duct and then to the small intestine. So here's our pancreatic duct that joins the common bile duct and deliver these pancreatic juices to the small intestine. So they aid in digestion. Now, there is another portion of pancreas called pancreatic islet that secrete hormones, insulin and glucagon. And those hormones regulate glucose level in blood. But that's endocrine structures. Exocrine structures, that is our acini, that secrete pancreatic juice. Pancreatic juice contains several enzymes, such as trypsinogen, procarboxapeptidase, chymotrypsinogen. So those enzymes are needed to break down carbs, lipids, proteins, and nucleic acids. Okay, so those were two large glands, liver and pancreas. We also covered other accessory structures in the first video that include salivary glands. I just want to remind you, parotid, submandibular, sublingual. We talk about tongue, that is accessory organ, and teeth. Now we will cover homeostatic imbalances, and we're gonna start with tooth and gum diseases. Dental caries or cavities is a gradual demineralization of enamel and dentin. A dental plaque is formed that is made of sugar, bacteria, and debris, and plaque is adheres to teeth. Acid from bacteria dissolves calcium salt that are found in enamel and dentin. Proteolytic enzyme digest organic matter and prevent, and then why you form those cavities, right? So it's an acid and proteolytic enzymes from bacteria that adheres to your teeth, so you start having cavities. And then infection can progress into a pulp cavity, and you can lose your tooth. Now, prevention is daily flossing and brushing. Gingivitis. Gingiva is gums, and when plaque calcified to form the calculus or tartar. Calculus disrupts the seal between gingivae and teeth. Anaerobic bacteria, that doesn't require oxygen, infects gums, and infection is reversible if calculus is removed. So here you can see healthy gums, and this is gums that are infected. Gingivitis, itis means inflammation of gingiva, that are your gums. Right. And again, it's formed because there is like a seal that disrupts the structure that formed from the bacteria that so this one we just go back, so the like a bacteria, then some sugar that you have, some debris, right? So when this calcified and form this calcified plaque, then we have bacteria that start dividing in this cavities and area between your gums and teeth that cause inflammation of gingiva, your gums. Periodontitis, that's inflammation of this periodontal ligament. And you remember periodontal ligament, it's a connective tissue that holds teeth in their socket. So here's our bone, right? And here the root of a tooth, and this membrane that connects root to the bone is called periodontal ligament. Periodontitis is immune disease when immune cells attacked your own body tissues and destroy periodontal ligament and activates osteoclast. And osteoclast dissolves a bone and So dissolve the sockets where your teeth are located. It also causes inflammation. So consequences is possible tooth loss, a promotion of atherosclerosis and clot formation in coronary and cerebral arteries. Peritonitis. And again, itis means inflammation. In this situation, it's inflammation of peritoneum caused by piercing of abdominal wound, perforating ulcer, or ruptured appendix. Peritoneal coverings stick together, localizing infection. It's dangerous and even lethal if we spread, and treated with debris removal and antibiotics. So you can see over here that peritonitis will cause fever, racing heart rate, abnormal breathing, extreme abdominal pain, nausea and or vomiting or constipation. But it's pretty dangerous condition, because if you have inflammation of your internal organ, the infection can spread to your bloodstream and be carried through other part of your body and can possibly cause a death of a patient. Heartburn. Stomach acid regurgitates into esophagus. So remember, we talk about, so here we have stomach, and stomach is below the diaphragm. So here's the diaphragm. So here's esophagus. Esophagus pierces through diaphragm and attached to the stomach. Now, where esophagus and stomach join, we have lower esophageal sphincter. What it does, it prevents the substances, the chyme and juice, stomach juice, from baking, going upwards to the esophagus. All right. So if we have this regurgitation of the stomach acid, then esophagus will be, so you will have this chyme, and chyme is very acidic in the esophagus, and esophagus structurally is not adapted for that high acidity. Stomach has lots of mucus over here and bicarbonate ions that prevent it from, protect stomach from acid. Small intestine or esophagus, they're not protected from the strong acid. That's why it can really cause inflammation of the esophagus, ulcers, and even cancer, right? So what happens sometimes, you can see that part of the stomach can actually move above the diaphragm, right? And when it's moved above the diaphragm, it will be easier for stomach juice to back up to the esophagus, and the sphincter is not going to protect it that well. Right, so it's likely with excess food or drink, extreme obesity, pregnancy, or running, or also with hiatal hernia, that is a structural abnormality of the stomach. So that's a hiatal hernia when we have part of the stomach above the diaphragm. It might happen because of the obesity, right, or because of the pregnancy. So part of the stomach above diaphragm, and that can cause esophageal ulcers or esophageal cancer. Gastritis is inflammation caused by anything that breaches mucosal barrier of the stomach. So you can see stomach ulcers over here. Peptic or gastric ulcers is erosion of stomach wall that can be so if you have gastritis, that is inflammation of the lining of the stomach, that inflammation can cause the ulcers. Ulcers can perforate, and then the food that you have in your stomach, or chyme would be the best word to use it, then it can enter your abdominal cavity. And what do you have in the abdominal cavity? peritoneum, right? So when it's perforate, it can cause peritonitis and hemorrhage. So in blood can also, if you have, if you have this ulcers that erosion, you have blood vessels, so you can have bleeding, hemorrhage, you can have bacteria entering abdominal cavity, peritonitis. Most of these peptic or gastric ulcers are caused by bacteria called Helicobacter pylori. And this bacteria is found in the pylorus of the stomach. So remember, stomach has several parts. The middle part is the body, and the last part of the stomach called pylorus. So that's Helicobacter pylori is the bacteria that reside, pathogenic bacteria that reside in the pylorus. And of course, antibiotics, if it's ulcers and gastritis caused by bacteria, and anti-inflammatory drugs are used when a patient has gastritis or ulcers. Hepatitis is usually a viral infection of the liver. It can be because of the drug toxicity or some poisoning, including mushroom poisoning, so inflammation of liver. Cirrhosis is progressive chronic inflammation from a chronic hepatitis or alcoholism. So hepatitis is usually that's acute condition, but when it's prolonged and chronic, then it causes cirrhosis. So liver, if liver is under inflammation for a long period of time, it starts forming scars. So that will be fibrosis and fatty liver. So fibrosis and fatty liver cause portal hypertension. So blood pressure is high, but it's related to a liver, not to the heart condition. Now, if patient has cirrhosis, then not that many medication that can deal with it. So usually they will need liver transplant. So they are successful, but of course it's not that available. So liver transplants are scarce. Gallstones are formation of the stones in either gallbladder. So it can usually form in a gallbladder, and then because this is where you store bile, and then we can have flow of the stones in the ducts, like a cystic duct or common bile duct or hepatic ducts, and they will restrict bile flow. So they obstruct flow of bile from a gallbladder, may cause obstructive jaundice, and jaundice is when patient has bile flowing in the bloodstream, then their skin and sclera of the eyes became yellow. That's what a jaundice is. A gallbladder contracts against sharp crystals. So you have those sharp crystals, and that cause pain, and treated with drugs, laser, vaporization, or surgery. Now, another homeostatic balance of the large intestine that called diverticulosis, and then inflammation called diverticulitis. So when we have low fiber diet, this causes colon or large intestine to become narrow. If colon is narrow, then you need stronger contractions to propel the chyme. So it increases pressure on walls, and it's called formation of diverticula. It's a herniation of mucosa. So if you see, that's a normal colon, right? But now when the colon became narrow and you increase the contraction, you might it might cause the formation of these little pouches, and those pouches are called diverticula, right? So it's like a hernia. So in a condition called diverticulosis, it's common in sigmoid colon and affects about half of the people who are 70 or older. So it's a disease that is very common in elderly population. Now, when this diverticula became inflamed, then it may rupture and leak. So whatever, what you have in your large intestine, these substances can leak into peritoneal cavity and may be life-threatening. Here's the appearance of diverticulitis through colonoscope. So here we have these little pouches in the mucosa, right? And then when it's inflamed, that's what diverticulitis is. Infection develops when a hard piece of stool or undigested food gets trapped in one of the pouches. This gives bacteria in the stool the chance to multiply and spread, triggering infection. About 95 out of 100 people have uncomplicated diverticulitis. It goes away on its own within a week. And about 5 out of 100 people, so about 5%, the symptoms may stay and treatment is needed. Surgery is only rarely necessary. Right, so usually, when a patient has diverticulitis, they will suggest them to change the diet, to have more fiber in their food, and hopefully it will go away on its own. And the last homeostatic imbalance that we will discuss is actually celiac disease. Now, celiac disease is gluten-sensitive enteropathy. When your immune system reacts on a gluten is a protein that found pretty much in all grains. Right, the only grain that does not have gluten is rice and corn. So when we eat bread, when we eat, like a cream of wheat, right? That is wheat. So there will be a protein gluten in this product, and some people are sensitive to that protein. Gluten causes immune cell damage, the intestinal villi and brush borders. So here's our food, right? And here's the gluten in a food, and that tells you that your immune system, right? So here's your white blood cells, right? Start making different chemicals, cytokinesis, and antibodies that will attack your own intestinal lining of the intestine, and you have inflammation, right? So if you have inflammation, then you damage those microvilli of the lining, and you decrease absorption, you decrease the surface area, you affect absorption and digestion of food, right? And that's the last slide. Okay, so I just want to remind you that we covered digestive system anatomy, and that was part 2 of the lecture. So make sure to watch the first part, and thank you for watching, and I hope it was helpful.